the CSI TV Kochi 2016. I am glad to have with me the esteemed Dr.PP Mohanan, who is the organizing secretary for the CSI Kochi. So let me begin with congratulating you for organizing such a wonderful CSI conference here in Kochi. So I will begin with how you feel about the CSI conference and how all the activities are being conducted in the CSI Kochi, sir.
Thank you. Pleasant morning and hearty welcome to all of you who is watching CSI TV. Well, CSI 2016 Kochi is a conference with a difference in many ways. We have about 5,000 delegates coming up for this conference. We have also delegates from the other countries like the African countries, other Asian countries, and the international faculties includes the doyens of cardiology in the world. We have the presidents of American Heart Association, the European Society of Cardiology, the World Heart Federation, and the American College of Cardiology, and amongst us. And in fact, for the first time in the CSI, we have a presidential conclave. All the presidents of the major cardiovascular societies, along with our own president, will be discussing the various issues of cardiovascular disease, the management, prevention, of course. Prevention of the cardiovascular disease is one of the most important things.
So sir, as I understand, so many activities are being conducted in the CSI. So how do you place a CSI with respect to the other conferences which usually we do in India and outside?
We're trying to be a little different in the sense that apart from the continuing medical education and updating the delegates about the advances in cardiology, we also thought that we should also educate the public.
Okay.
As we were discussing right throughout, prevention becomes very, very
Right.
important. So what we have done is that we have come out with a book written by 143 cardiologists in Kerala.
Right.
That's again is for the first time.
Yeah.
Taken, but it's titled as Knowing the Heart and Knowing Heart Disease. Hridayate Ariyan, Hridrogangale Ariyan. So this is something will be very useful to the, now we intend to translate it to the English also, so that I'm sure this will be widely appreciated by the public to know about the disease. That's one. The second thing we intend to release is a public app. We have christened it as the Hearts app,
Okay.
which will have if someone in Kerala has a chest pain, develops chest pain, you just need to press a button,
Okay.
and immediately the list of hospitals comes. The list of lytic hospital comes, the list of cath-enabled hospital comes.
Okay.
So depending upon the time frame, as we know, reperfusion has to be done
Right.
and at least within 90 minutes, the catheter-based reperfusion. So he will be helping the patient to choose one of these hospitals, and as soon as he presses one button of this hospital, somebody from the hospital will respond to him.
Okay.
So we are sure this will be also useful to the public. The third thing that we are doing is yoga sessions,
Right.
especially for the delegates, because yoga has become one of the important measures of, again, of preventing cardiovascular disease, and its importance has been now widely known, and yoga started with us in India.
Right.
So every morning in 3 days time, starting from today,
Okay.
we intend to have a 45-minute session on yoga taught by 2 eminent yoga acharyas.
Okay.
So that the idea is in about 3 days time, you have somebody who attend this function will be able to practice it by themselves. They don't need to go for any other thing.
Right.
The fourth is on the marathon that we are doing on 10th morning. We have a 10-kilometer
Okay.
marathon or walkathon,
Yeah.
and which is to be participated by the Indian Navy, and the other souls of Cochin, and quite a lot of people. Again, just to sort of now
Right. Sir.
stress the importance of walking and the exercise, which is again unfortunately practiced by so few amongst our public.
Right, sir. So, sir, so many things have been planned and executed very nicely in the CSI coaches. Some are like unique kind of things that has been planned. So, sir, as you rightly said, the prevention is the key for any disease or any as such as prevention of the disease. So, sir, how you see the response of the people for yoga sessions as well as for the CSI marathons?
Well, the yoga sessions had captivated a lot of interest. Our own Prime Minister Modi, and you would have seen him in action in various occasions promoting. We have now an International Yoga Day, thanks to him. So, I mean, the response has been pretty good. And so the marathon, we have already about 650 people registered for the event, and I'm sure
Great.
the number will swell by the time we start it tomorrow at 5 o'clock in the morning.
Right, sir. So, sir, as the conferences go on year by year, so we are better using the technology. So, as we can see in the CSI, we have developed the app. So, how it is going to be useful for the people, and how will be the response of the people for such apps?
We presume, actually, no, this is all the hard work and the devoted and the united. I'm really proud that I'm a member of the Kerala chapter of the CSI, because we in Kerala, the cardiologists in Kerala, have been doing wonderful work, be it in clinical cardiology, being research. I'm sure at least the cardiologist in the country knows that we published the largest registry of acute coronary syndrome in India.
Great.
Again, we have another 6 or 7 registries on cardiovascular disease coming up. And this is possibly for the first time in India. We are trying to accrue more and more data on cardiovascular disease so that we develop ourselves and the nation benefits come out with some position statement, guideline, which will be tremendously helpful to the cardiologists and physicians. That is again the hard work, the devoted work of my team members, which is about 120 cardiologists in Kerala are working for the last 1 year for these programs. These are all the handy. Whatever apps, whatever other programs that we have planned has come because of the united efforts of the cardiologists from Kerala, and I'm extremely thankful to them.
Right, sir. So, sir, in continuation to that, so we have so many sessions on various burning topics, which will be definitely helpful for the physicians in practicing day to day. So, how is your view about all these sessions which are being conducted by the eminent speakers, national as well as the international speakers, sir?
For a change, I'm also seeing the many a time you see speakers talking to empty halls. Fortunately for us, I was really impressed by the attendance right from the morning until in the evening, late hours of evening. The halls are almost full. The faculty seems to be extremely happy interacting with the people, and our scientific program, which has been designed by Dr. M.S. Hiramat, looks very attractive, looks very educating.
Right.
So I think the people are really enjoying the scientific program apart from our hospitality.
Right, sir. Great, sir. So, sir, lastly, sir, so your key message for the delegates who are attending the CSI Kochi conference, sir?
Well, educate yourself, learn from the erudite masters of cardiology in the world. We have plenty of them around. Make use of them and also enjoy the Kerala hospitality.
Great, sir. Thank you. Thank you so much, sir.
We have christened it as the Hearts app,
Okay.
which will have if someone in Kerala has a chest pain, develops chest pain,